You are listening to UIC Radio, broadcasting 24/7 at uicradio.org. Welcome to the Dr. Paula Show. I am your host, Dr. Paula Allen Mears. This show aims to highlight issues surrounding health literacy. The National Academy of Medicine defines health literacy as the ability to obtain, process, and understand the basic health information needed to make appropriate health decisions. There are 32 million citizens in the United States who cannot read or write at a basic level, and nearly 9 out of 10 adults have difficulty utilizing the everyday health information routinely available in our healthcare facilities and retail outlets. This can lead to adverse health outcomes, such as a lack of trust in the healthcare system, an increased prevalence of chronic illnesses, low usage of preventative health services, and an overall increase in mortality rates. On this broadcast, I showcase the excellent work that is being done at the University of Illinois, Chicago, and elsewhere to promote health and wellness. Today, however, our program is presented as part of the Rockford Ready initiative. The Rockford Ready initiative is led by the City of Rockford's Health and Human Services Department in partnership with the University of Illinois, Chicago, its College of Medicine, and its Office of Health Literacy, and the College of Medicine at Rockford. We also have another partner, Cura Strategies, and many leaders in the Rockford community are a part of this initiative. Rockford Ready is an initiative dedicated to improving the health of Rockford residents by providing health education, connecting residents to health resources, and strengthening relationships between healthcare providers and residents. Today, I will be interviewing a resident of Rockford, Illinois, Mr. Elias Suarara, who is a very active member in the Rockford community. He has worked for the Rockford Housing Authority for 24 years. His family resides in Rockford, and in his spare time, he is a poet. My other guest is Dr. Olga Garcia. She is a physician and associate professor of medicine at the University of Illinois at Chicago. I am delighted to have these two guests present today to talk about COVID. We're delighted to have you here to talk about your experience. You had COVID twice. You are a member of the Rockford community. You served as a member of the community of concerned. It was a group concerned about the Winnebago County Health Department. You had a role in that. Or am I wrong about that?
Yeah, correct, yes.
Okay. And you're a poet, is that correct?
I do. I had
Mike?
I spent enough time at home that I wrote a couple little poems, yes.
And then you grab a mic and you share your poetry with a very diverse community of Rockford residents.
Yes, open mics, usually open mics or just anything that if they have a spoken word night, sometimes I'm there. More often than I should, but yes.
The other person I want to introduce before we move ahead with a conversation about COVID and the experiences of our primary interviewee and Dr. Olga Garcia. I want to say a bit about Olga Garcia. Dr. Garcia is an internal medicine specialist at UI Health. She is an expert in caring for people with chronic illness, diabetes, and hypertension. And she has a deep interest in preventative medicine and women's health. She wears a number of hats. Too many for me to mention. It would take all of our time to talk about the many hats that she wears in terms of promoting research on health disparities, equity issues, and various studies of the Hispanic populations. So I'm delighted that she's here this evening. So our interviewee this evening, who has corrected, I'd like to hear though more about the 10 pronunciations of your name, but we'll do that a little later.
Yeah.
Tell us about your experience with COVID. When I talked with you earlier, you said you had COVID twice.
Indeed, indeed. So I work with at Rockford Housing Authority. I deal with people every day, and so when the information started coming out, of course, we right away we moved, and our superiors there started receiving information from different agencies, health agencies, and of course the Winnebago County Health Department. And so, of course, we had to take it to heart. But even then, because of the limited information that we had, we never thought of how's it going to affect any individual, right? Because at the time we didn't know. We figure it's going to be like the flu. Everybody's going to see that you're sneezing, you're coughing, you feel tired. Perfect. If we know that you're sick, you're going to go home. But no, that wasn't the case. I happened to go to work on a Monday, and I was feeling fine. And a friend and one of my coworkers looked at me, saw me. He goes, "Hey, man, you're looking pretty rugged there, man. Must have been a tough weekend." And I said, "Oh, no, not a fact. I slept well. I stay home. I eat healthy, and no, I'm ready to go." But somehow I came home that night, and same thing. My daughter says, "Dad, I've been coughing a little bit, so I think I'm gonna have to go," because she was going to school. So I think I'm gonna go have a test on Monday night. And so on Tuesday morning, she went and had the test. And I think we already had started working from home at the time. And so I was home when she came back, and she said, "Yeah, Dad, I have it." I said, "Oh." I said, and she goes, "Well, you have to go as well, because here you are, you're talking to me, so you have to go now." So I said, "Well, let me set up a time." And I went Wednesday afternoon. I showed up at the immediate care, and sure enough, came back with COVID. And people were saying, the nurse says, "Well, if you feel that you're running out of breath, or that you are sluggish, that you're tired, or if you feel that you need to be in the hospital, let us know." But you don't have to. You don't have to run off to the hospital right away, because we don't know exactly how it's going to affect you. So basically, for the first 3 days, I was just feverish, coughing, sneezing. On the fourth, fifth day, my daughter was ready to go, and at that point, she looked at me like say, "Dad, it's time for you to get it together, man. It's 5 days. You should be okay." I said, "Well, no, I'm not. Let me go to sleep." I was sleeping about 17 hours a day, and it went on for an entire month.
Wow.
I had it, but it got to the point where the second time I saw a doctor was by teleconference. So of course she said, "If you feel a certain way, go to the hospital. If you're fine, don't worry about it. Just stay home and try not to infect anybody else." So I stayed home. The third time I went to see the doctor, it was in person, and he came and said, "Well, I see that you're having a hard time breathing. So how long it's been like that?" I said, "Well, it's been about 3 weeks already, sir." And so he said, "Well, you want to go to the hospital?" I said, "Well, no, I can still do things. I can still move around. I tried. I wasn't sleeping anymore as much." So I said, let me stay home. And of course, if I feel that, I'm not catching my breathing normally, then of course I'll let you know, and I'll be going to the hospital. There was no need for that. And he most likely, the last time I met with him, says I was fine. He was just doing a follow-up. And he said, "So how did it go, Elias?" I said, "You know what? I stayed home the entire month. There was no problem there." And he said, "Are you sure you're not having any other type of condition?" I said, "No, I'm feeling fine. Still, no taste, no smell, but it's taking up to 6 months." By then, we already started getting all kinds of information, right? So I said, most likely it's going to be about 6 months before I catch up with everything else.
Sir, what year was your intake? What year was the onset of COVID? Was it in 2019 or 2020? Because there was been an evolution of knowledge
Sure. No,
the past 2 years?
I
When did,
believe that, like I say, at first, uh, I believe we started getting information toward the end of 2019, I believe.
Mhm.
Uh-huh. Or 29. Yes, 29, because in 2020, that's when I became sick. In January of 2020, I became sick.
That's when you became,
Mm.
and there was no vaccine then available, is that correct?
Vaccines came,
I'm trying to remember
the vaccines came later on in the,
later. Okay,
yes,
okay, thank you.
sure.
Thank
There was some medication that people were taking, but it wasn't working. I mean, again, the doctor didn't even tell me. He didn't even give me any medication. He says, there's nothing I can give you. There's nothing I can give you. You just have to be careful what you do and don't be around people. That's all. That's the
Mhm.
best approach is to stay away from everybody and everything. So,
Mhm.
the appetite changed as well. My appetite changed quite a bit.
Mhm.
Of course, what took over was the sleeping hours. I mean, that was the priority for me. I would wake up for about 2 hours and I had to be in bed right away because I couldn't stay awake.
So let me understand, when we talked before before this formal interview, you said you'd had COVID twice. You'd had COVID
Sure.
at the onset of the discovery of COVID, right?
Yes.
COVID.
Uh-huh.
And then you had it again.
Yes.
And there was no vaccine early on when you caught the disease,
Correct.
but now I'm just trying to get the historical perspective here,
Sure.
evolution of the illness and your
Sure.
experiences.
Uh-huh. Yeah, no, there wasn't any, and again, just but as soon as the vaccines was available, then of course I went ahead. I didn't even think about it. I just said, I'm going to get in line because, but I work with people. I have to be careful about that. I have to be cautious. I work with people. I wouldn't want anyone to be not knowing or knowingly that they will be infected by me. So, I make sure that I went and follow through with my vaccines, just to avoid any type of problems later on during that time. Yes.
Do you have any advice for our listeners? I mean, in terms of your experience, again, you had COVID at the onset. We had just discovered COVID-19, and then you had a 6-month episode of it, and then you were vaccinated, and then
Yes.
you told me when we were talking that it came back again, but you were vaccinated and you never experienced hospitalization as a consequence of COVID-19.
The second time around was toward the end of summer, in 22, and it was a total, complete different symptoms. I mean, I was very surprised about that because it was a total 180-degree change. The first time around, I was sluggish, tired, lost my appetite, lost my sense of smell. I couldn't breathe for about 3 months. I was still having issues with the breathing process. But the second time around, it was mild fever, very mild, and no tiredness whatsoever. And it only lasted about 10 days. But I have the vaccines. I have been vaccinated.
Oh, thank you for sharing your experience. I'm going to now turn the interviewing to Dr. Olga Garcia. Dr. Garcia, you heard our interviewee talk about his experience and some of the manifestations of COVID-19. You took care of a large number of patients at UI Health. Would you like to share your experience and observations with us?
Yes, and thank you for having me and for the invitation, Dr. Alamir as well. And Elias, thank you very much for sharing your story. And something that is striking about your story is how is the difference between the first time that you have the symptoms of COVID-19, how long they last, you didn't have a smell and sense of taste, and what happened after you get vaccinated. Seems like there were two different symptoms and the length of the time that you were sick. But my experience is that on the first stages when 2020 COVID-19 came, we did not know much about the disease, but that has evolved, and now we have more knowledge and we have better treatment. We have medications that we can use for patients that they don't need to come to the hospital. They need to come to the hospital. Patients where the immune system is weak, or patients who have other medical problems or comorbidities, what we call. In addition, we have something that has been very important is the availability of COVID-19 vaccines that really has helped us tremendously.
Thank you. Do you have any advice to either one of you have any advice to our listeners in terms of COVID-19? Do you have any advice for our listeners? Do's, don'ts, where to go for assistance, etc.
With the with Winnebago County Health Department, I mean, they were on top of that, and again, I was part of their community concern. So all the information that was coming in, they were able to disseminate, and of course, they were using us as well to share. I think it was such a vast approach that the information was available. Information was always available, and every time that I was able to speak to someone about it, I would make sure that this is what we have to follow. We have to follow what the doctors have to say. I'm not going to mince words with that. Whatever the scientists come up with and tell us, we have to listen to that, because that's the most important and clear information that we can take advantage of. And so again, I through the Winnebago County Health Department, I was able to comprehend that if you don't share the information that you get through the doctors, you're not going to have any information to give. So yes.
Thank you. Dr. Olga Garcia, any final words for our listeners?
I would say that it's important to continue to know that COVID-19 is here. Yes, we have more relaxed restrictions, but something that I want to say is COVID-19 has helped your body to develop protection from COVID-19. Even though sometimes you get the vaccine, you can get sick, right? But what we're saying is that you're going to decrease the risk of being hospitalized or being very sick or dying from COVID-19. And more importantly, is that we're protecting our families and communities. What we're seeing is that even though people that are young age, when they get COVID-19, they transmit it to households that are elderly, and those are the ones that they have a high risk of getting sick or dying from COVID-19. And something that that I would say is more important, that we need to continue to be aware of prevention. So staying up to date of COVID-19 vaccines, getting treated for COVID-19 if needed, follow recommendations if you get exposed, staying at home if you suspect that you get COVID-19, and seeking treatment. If you have any questions, seek for healthcare providers. Now, CDC has an excellent website, or any kind of information that is reliable, that you trust. Is not whoever told you, but how we can get reliable information, first-hand information, like Elias mentioned. He got the disease, but in addition, he's part of how we can spread the word in a reliable, concise, and accurate way. And I would say avoiding contact with people who have suspected of COVID-19. So we need to continue to be vigilant, and we continue to protect us, our families, and the communities as well.
Thank you. As I said earlier, we are a part of an initiative known as Rockford Ready, and there is a website, and the website is at rockfordready.org. And on that website, you will find resources that are very, very, I think, useful in terms of managing COVID-19. Well, I want to thank you, our guest this evening, for participating in this conversation about COVID. I really appreciate the time. And I want to thank Mark Miletus for allowing us to use excerpts from his original composition, Music for 5 Musicians, on the show. And you are listening to UIC Radio, broadcasting 24/7 at uicradio.org. Thank you.